Good morning and welcome to Good Food Unearthed. We have with us today Dr. Neal Barnard, President of the Physicians Committee for Responsible Medicine. He's a physician, clinical researcher, author, and adjunct associate professor of medicine at the George Washington University School of Medicine and Health Sciences. And you work with patients who have diabetes, obesity, and other chronic diseases in clinical research studies aiming to improve the prevention and treatment of these health problems. So welcome to the channel.
Thank you. Great to be with you.
And one of the things I'd like to delve into right away is something that's personal to me and that I know affects a lot of people, and that's type 2 diabetes. So from the information I've come across, it appears that by definition, type 2 diabetes is 100% curable by a change in diet and weight loss. And most people think that it's sugar that needs to be avoided and that sugar causes type 2 diabetes. But could you tell us actually what appear to be the causes of type 2 diabetes?
Sure. It's a great question. It's certainly very timely because diabetes is just an epidemic that's hitting more and more people all across the globe, and it's hitting people younger than ever. We used to say to get type 2 diabetes, you had to be 40. Well, now you can be 14 and get the problem. And it's understandable that people would blame sugar because when a person has diabetes, they do have too much sugar in the blood. Their blood glucose rises. So it was sort of natural that people would blame sugar. And if they would eat sugar, their blood sugar would rise. So they thought, well, that's got to be the cause. However, it's not the cause. And your body should be able to handle sugar without your blood sugar rising unduly. And normally the system is that you take in sugar, whether it's from fruit or other natural sources, or you take in starches, which digest release sugar. You get into your blood, the glucose gets into your blood, and it passes into your muscle cells and your liver cells and your brain, and it powers those. So sugar is not a bad thing, it's a good thing. The problem in diabetes, in type 2 diabetes, is that the muscle cells and the liver cells in particular are having trouble taking that glucose out of the blood. They're not pulling it into the cell. The reason they're not pulling it into the cell is because there are fat particles that are building up in the muscle cells and in the liver cells that are interfering with their ability to remove sugar from the blood and bring it into the cells. So that's the problem. The problem wasn't that you had bread for lunch. The problem was that your bread was a sandwich, and that inside the sandwich was a whole bunch of cheese and turkey slices and mayonnaise and butter and all that stuff. And that's what gets into the cells and interferes. What it's actually doing is it's interfering with the action of insulin. And the insulin has the job of pulling the sugar into the cell. So that's it. So that also shows us the answer, which is to get all that stuff out of our diet, and then diabetes can improve.
Right, and it's like you were saying, when we eat sources of sugar like carbohydrates, we get blood sugar going through our bodies. So people are kind of concerned when they have raised blood glucose levels after eating, but isn't that normal to have just after you've eaten?
Yes, it is completely normal. That's the way the system works, that your blood sugar rises, and then as the sugar passes into the cell, it comes back down. Now, I should say this. If a person has type 2 diabetes and they switch to a low-fat vegan diet, over the long run, what they'll discover is their blood sugars come down and their hemoglobin A1C, which is an index of long-term blood sugar control, that improves too. But the first couple of days, their blood sugar might be higher than normal. And the reason is, just as we've seen, their cells are filled with fat particles. And that fat's not gone on day 1 or day 2. And so if they eat spaghetti or an apple or something, their blood sugar rises, they freak out. And they think, see, I can't eat spaghetti. But typically what happens is if they stick with it, within just a very few days, everything turns around and goes in a better direction. I should also say that different carbohydrates are different. There's no need to go to the store and buy yourself, a big soda and drink down, 250 calories worth of pure sugar effectively. There's no reason for that. But if you're getting sugar in the form of fresh fruit, it comes along with nutrients and fiber. And when we have sugars in their natural form, for the most part, they're low, what we call low glycemic index.
Mm-hmm.
They enter the bloodstream gently, gradually, and the body can handle them more easily than it can handle just a huge dose of sugar that would come from, say, a soda or maybe a slice of white bread or something like that.
Right. And what exactly is the glycemic index? Why was it created? And is it really a guide for people to look to? Because I know there are some foods on the glycemic index that are high, but they're really healthy. And then there are some that are low on the glycemic index, but they're not really that great for you.
Are there certain foods that you were thinking of?
Well, I believe on the one side, like white potatoes, they're high on glycemic index, but they are pretty good for you. And then on the other end, you have some junk foods that are really low on the glycemic index. But
well, the glycemic index was invented, I think it was 1981. It was invented by David Jenkins at the University of Toronto. And David is a tremendous researcher and innovator and has really been a leader in nutrition for generations. And the glycemic index is a way of describing different kinds of carbohydrate-containing foods. Mm-hmm. So you bring in some college sophomores and you feed them 50 grams, I think it is, or I forget the amount, but I'm going to say it's 50 grams of whatever the test food is. Mm-hmm. And then you watch them over time, and then you track how their blood sugar rises. Mm-hmm. And then with some relatively simple calculations, you can rate foods. And the glycemic index will say, okay, a high glycemic index, like sugar or white bread, simply means your blood sugar rises pretty high, mm-hmm. Fairly quickly, whereas a low glycemic index food, or lower, like instead of white bread, have rye bread or pumpernickel bread. Mm-hmm. It's more gentle on your blood sugar. So foods are described in this way. I should mention, in our diabetes research studies, our first rule is vegan, no animal products. Our second rule is to keep oils really low. Mm-hmm. So even vegetable oils, we keep them low because I want to get the fat out of your cells. And then the glycemic index for us is rule number 3. And we do use that, and it does seem to give people some additional benefit from the standpoint of blood sugar control, and also bringing their triglycerides down. Their blood fats will go down a little bit as well from favoring low GI foods. But you're right, potatoes are, generally speaking, a pretty healthy food, but they do tend to release glucose into the blood more rapidly than, say, sweet potatoes, which is funny. Sweet potato has a lower GI than a white potato. And then there are plenty of foods that have a low glycemic index, but they're terrible. I mean, butter doesn't have any carbohydrate in it. So if you eat it, it won't really raise your blood sugar immediately, but that butter packs into your cells, and it's going to make your blood sugar control worse in subsequent meals. So you don't want to go there at all. But the glycemic index for me is rule number 3. It's not rule number 1.
Right.
So
yeah.
Keep it vegan, keep the grease out, and then use the GI to kind of sort out what's left.
Right. So I guess, like, if you're treating somebody with type 2 diabetes and they can't metabolize the carbohydrate, then it's good to consider lower glycemic index, healthy carbohydrate foods. And then afterwards, once they're able to metabolize it, they can have things like white potatoes without worrying about a spike.
There really are some surprises here that people need to know about. Fruit tastes sweet, but it has typically a low glycemic index with very few exceptions. Mm-hmm. And so I can't tell you how many people with diabetes think they shouldn't eat fruit. You think, what are you talking about? Fruit is loaded with vitamins and loaded with nutrients. It's a really healthy thing. And it beats the heck out of plugging quarters into the candy machine and getting some junk food. You should have fruit all over your table, all over your desk, in your fridge, everywhere, and use it as your go-to snack to have and to share. And another funny surprise for a lot of people is spaghetti. If I take white flour and I make bread, it causes my blood sugar to rise. But if I take white flour and I make spaghetti, my blood sugar doesn't rise so much. It has a much lower GI. And the reason is not rocket science. It's just that spaghetti is very compacted. Whereas bread it rises with yeast, and so it's filled with air pockets. And your stomach acid and digestive enzymes can tear apart that glucose pretty fast, but with bread, but not with spaghetti, because no matter how much you chew it, spaghetti started out very dense, and it just digests more slowly than than white bread does. Now, some people will say, well, make it whole wheat spaghetti or whatever. Fair enough. But in our NIH-funded study where we used vegan diets for type 2 diabetes, we allowed people to have plain old white spaghetti if they wanted to, but you couldn't have the Alfredo sauce on top of it or the meat sauce. It had to be, a light tomato sauce or something healthy on top.
Yeah, and I think so when we're talking about getting fat out of the diet, most meat products are 60 to 80% fat. Butter and oils, they're 100% fat, and cheese, it's like around 70% fat. So those are, the kinds of foods, I guess.
Exactly. I think people imagine, they imagine that, say, poultry is low fat or fish is low fat. It's not at all. With, relatively few exceptions. If you take some Atlantic salmon, which people think, oh, it's got good fat, well, it could be 40 or 50% of its calories from fat. And that will pack into your muscle cells just like fat from a steak. So if a person has diabetes, they're trying to get rid of it, I would not go to salmon or chicken or turkey bacon or any of those kinds of things at all. I would go toward a completely plant-based diet.
Yeah, and I wonder if you could talk a bit more about the research study you did comparing the American Dietetics Association recommended diet to a low-fat vegan diet, and what were the results from that?
Yep, we've done a couple studies using that comparison, and the one that I think people know about the most was the first results were published in 2006 by the American Diabetes Association. To their credit, they published it in their journal called Diabetes Care. What we did is we brought in people who had type 2 diabetes. Half of them went on what I'm going to call a conventional diet, meaning limit calories so that you lose weight and don't overdo it on carbohydrate. And then the other half went on a completely vegan diet, what we've been describing, vegan, low fat, low glycemic index. And then when we compared those people who made no changes to their medications, they weren't changing their exercise or anything else, the people in the conventional group did pretty well. They dropped their A1C, their hemoglobin A1C, by 0.4 percentage points, which is a good reduction. The vegan diet dropped by 1.2, in other words, 3 times bigger, and they lost marginally more weight, despite the fact they weren't counting calories, and their bad cholesterol goes down, their blood pressure improves, everything gets better with this approach. And we now feel that a low-fat vegan diet is the way to go, both to prevent diabetes, but also to treat it when a person has it.
And a lot of this research into diabetes, this has been going on for a long time, and there are studies in the medical literature going back to like the 1920s and the 1930s. Like Shirley Sweeney in 1927 studied some healthy medical students where he fed them a carbohydrate diet that was basically sugar, candy, pastry, white bread, and their blood sugar was measured over several hours, and that remained normal. And then when he put them on a high-fat diet, every single one became diabetic. And the same in, there are similar studies in 1934, and then also in 1927, Elliot Jocelyn wrote, "I believe the chief cause of premature atherosclerosis in diabetes, save for advancing age, is an excess of fat, and in the body and in the blood and in the diet." Again in 1930 with Rabinowitz, and then the Pritikin Longevity Center showed that by changing people's diets, diabetics could come off of their medications. So this has been kind of existent in the medical literature, but it hasn't really been translated into day-to-day practice. I know that most people still, they're not told to go on to a diet like you're recommending, the low-fat vegan diet, which can reverse their disease, but instead they're given diabetic pills or insulin to take. And I'm wondering if you could comment on why that might be, and also how effective those medications are for people taking diabetes.
Yeah, I should say that there are practitioners now using this approach, so things are getting better. There are more and more doing it all the time, and every year when we get together for our International Conference on Nutrition and Medicine, we have just hundreds and hundreds and hundreds of doctors. This past year we had more than 1,000. there. So anyhow, the world is changing, and there are more and more people doing this. The American Diabetes Association, as I mentioned, did publish our results back 13 years ago now, and accepts them. And when they publish every January, their clinical practice guidelines come out, they talk about vegan diets. It's not the only option they talk about, but they do mention it. So it is getting used, and people are aware of it, which is a good thing. But far too many people are rooted in the idea that if you got diabetes, you'll always have diabetes, and the best we could do is just manage it, and by giving you medication, and you may need medication, it's possible. But type 2 diabetes is not caused by a metformin deficiency. It's caused by fat getting into your muscle and liver cells, interfering with insulin's activity. So let's get that out of your diet and see what we can do to turn things around. I should say that if a person has had diabetes for a long period of time, their pancreatic cells that make insulin are getting beat up pretty badly. And so their diabetes may not go away, but it can improve, and their blood sugars can come down. They can reduce their medication use, sometimes get off them completely. And the most important thing is that the complications of this disease, like blindness and amputations and loss of kidney function and heart attacks, when you change your diet in the way that we've described, your risk of all those things plummets. And so that should be our mainstay. It shouldn't be just one prescription after another. And frankly, that's true for other things too. It's true for cholesterol problems. A person comes in with high cholesterol, that's not caused by a Lipitor deficiency. That is caused by the cheeseburger they ate yesterday, or the chicken nuggets and all those, and cheese and these kinds of things. And so if all we do is hand out prescriptions, we're really tying our hands behind our back. And if, let's say, a person is taking Lipitor or other statins for their cholesterol, and they go on a vegan diet, the effects are additive. The plant-based diet doesn't have any cholesterol in it, doesn't have any animal fat, so their cholesterol levels plummet. And I would strongly urge practitioners to focus on the causes of these things rather than trying to medicate them away. Medication deficiency is not the issue.
Right, and I guess the thing is, when you're treating with medication, the high blood sugar, high blood pressure, and cholesterol, those are kind of symptoms that your body's telling you something's not right. And you can suppress them a little bit, but you actually, in a lot of cases, can make matters worse.
Medications are a double-edged sword, and I'm quite prepared to believe that there are benefits from medication use in many cases, but there are also risks as well. And it becomes a little more clear over time. Let's say a person goes on insulin, which they may need. I mean, there are people who do. But when they're on insulin, they suddenly discover they can't lose weight. They're having tremendous problems with it. If a person goes on Lipitor, we've originally thought that the statin drugs, Lipitor, Mevacor, Crestor, others, we thought they were pretty safe, and they are pretty safe. However, they cause, for some people, liver problems. For some, they cause quite serious muscle problems. They cause a bit of weight gain. They increase the risk of getting diabetes. And you think, good grief, if I don't need this, if I can just do it with diet, let me do that instead. So I always encourage people to focus right up front on food, because food is 90+% of the game.
Right. And before I go on to the next question, you mentioned statins and the side effects of statins. And I believe you gave a presentation once where you mentioned how some patients, elderly patients who were thought to have Alzheimer's, were on statins. And that can be a possible side effect of taking statins, to have symptoms of Alzheimer's or develop symptoms of Alzheimer's, but then to remove the statins, the symptoms go away.
Yeah, amazing thing. I'm going to give credit to a doctor named Dwayne Gravlin, who was he was a doctor working for NASA, and he drove home from NASA one day, got home, and got out of his car, and there was a woman standing on his front porch, and he said, "Hello, may I help you? What do you want?" Basically, and she said to him, "Dwayne, I'm your wife. Don't you recognize me?" And she was his wife, but he did not recognize her, and he had this huge memory issue, which they suddenly discovered. She packs him into the car. They race off to the emergency room and say, what has happened, to his memory? And he had all kinds of gaps in his memory. And he was not an old I mean, he was a little bit up in years, but he was not by any means elderly. And the only thing they could think of was he had started Lipitor to lower the cholesterol level a number of weeks before. And so they stopped the Lipitor just to see, and his memory completely returned, 100%. And so did his high cholesterol, because he didn't change his diet. And so they later on started the Lipitor again at half the dose, and within about a month, his memory was wiped out. Everything after age 13 was gone. And so they panicked. The Lipitor is now in the trash can. And eventually he got his memory back, but he went to the FDA and he said, do you know about this? And of course the response is, I wouldn't worry about it. I mean, statins are safe, but he wasn't the only one. There were many, many other people who started to report to the FDA that they had taken Lipitor or other statins and had these dramatic problems with their memory, including, just as you said, people diagnosed with Alzheimer's disease. It went away when they stopped the drug. So once again, I don't mean to say that there's not a role for statins. I think there is. And lowering your cholesterol level is a good thing. It's good for the brain, just like it's good for the heart. But let's start with diet. And let's not pretend that drugs don't have dangers, because they do. They have, in some cases, very serious dangers. And now, if you look at the prescribing information for Lipitor and other statins, it includes this. It says, by the way, there are people, it's not common, but there are people who have these devastating memory issues that can come from a statin.
Right. And so diet as being like 90% of the game. When people do change their diet and they have type 2 diabetes, how quickly does it work? Like, how quickly will they need to look at or be aware of having to reduce or stop their medications?
Well, you want to be aware of it right away. And if anybody's doing this, be sure that your doctor or clinician is aware that you're making a diet change, because a vegan diet, when I say a low-fat vegan diet or plant-based diet, however you want to refer to it, this is not like other diets that kind of take their time and you get kind of this very non-existent effect. Vegan diets for some people are very powerful. And if you are on, say, insulin, and you start a healthy low-fat vegan diet, which I recommend, be prepared to track your blood sugars on a daily basis, because your blood sugar can go bang down. And of course, patients are thrilled with that, because that means the doctor's going to taper them off their medication, which is great, and that should happen. But you have to anticipate it. The doctor needs to work with you and be ready to bring you down on your medications right away, because a low blood sugar can be dangerous. So,
right.
Same with blood pressure. When people are on blood pressure medicines, some people are on 2 or 3 blood pressure medicines, and now you're suddenly changing your diet. Well, a low-fat vegan diet reduces blood pressure too. It's really more gentle than its effect on blood sugar. It can take more time, but you suddenly discover you get up from a chair and you're kind of woozy, and that's because you're on a healthy diet and your blood pressure's been coming down, but you're still on all those medications at the same time. And so the answer is to work with a doctor to taper off your medications at the appropriate pace for you.
Right. And say like you're at home and you're monitoring your blood sugar and you feel like it's a little bit low, not like super dangerous, but what are some like quick little carbohydrate boosts that you could eat that would really ease those symptoms?
Yes. The symptoms are going to be shaking or sweating. You'll feel emotionally different. You'll feel nervous or tired. You feel very hungry often. These are all signs that you don't have very much sugar in your blood, so your body is crying out for sugar. For most people, the first sign is kind of shakiness and weakness. If that happens, get out your meter, check yourself. And different doctors have different numbers where they want the patient to call them, but it's usually 65, 70, somewhere in there they start to get nervous. And if it's low, this is the one and only time where Dr. Barnard is going to say junk food is now your friend, because it will get your blood sugar back up. So you go to the refrigerator and have a soda, not a diet soda. You want the sugar to get back in, or bread or something like that, and then test again in 15 minutes. But frankly, my favorite thing is not to have soda and bread in my fridge. The best thing is to go to the drugstore and get these little glucose tablets.
Mm-hmm.
And you take 4 of them usually, and that'll bring your blood sugar right back up. And the thing about them is nobody snacks on them. You keep them in your glove compartment or in your desk or in your purse or wherever, and they're just there if you need them. And by the way, if you're not taking any medicine,
Mm-hmm.
you're not going to get hypoglycemic, so don't worry about it. And it's really for people on insulin or on sulfonylurea drugs.
Yeah.
Certain other drugs like Starlix can occasionally do it, but if you're not on medicine or if you're only on metformin, it's not terribly likely that you're going to get hypoglycemia.
Right. Yeah. And